In this video, I want to talk about the 5 tests that we use in clinic to be highlighting whether there's any muscular or strength imbalances between somebody's left and right hand lower limb strength, and ultimately how we can help them to be running faster, further, and most importantly, pain-free. So stay tuned. Thanks for checking out this channel. My name's John. I'm the head therapist here at John W Sports Injury, and here at this channel we want to help people to understand their body, to eliminate their pain in order to ultimately be achieving all of their sporting and exercise goals. So what I want to be talking about today really is highlighting muscle imbalances, because if we take something like running and we think about the body, what the body's fantastic at doing is compensating. So if something's got an inadequacy or a lack of strength in one side through those lower limbs, then what the body will do is compensate and find the nearest muscles that can be creating that function, that can be supporting and balancing out this imbalance. But the problem for us is that if that's happening over a period of time, this dysfunctional activity that's happening where muscles that are having to work harder in order to support the imbalance, it will ultimately lead to a dysfunction, which leads to injury. And when we think of a sport like running and we're going through that repetitive motion, ultimately your body will compensate, but then it will suffer as a result of that dysfunction. And that can be in a sport like running or cycling in repetitive sport, but also something as simple as running around a football pitch or a tennis court. The compensation will happen, but ultimately lead to a dysfunction. So what I want to do is talk through 5 tests that we do in clinic that you can be doing at home that will be identified to you where you're stronger, where you're weaker, and ultimately where you need to then balance out to have this fully functioning body. So the first test that I use is a test called the single leg glute bridge. Now what we're looking to do here is really be testing the strength or the recruitment of what we call your posterior chain, which is muscles like your glutes and hamstring muscles. So in this exercise, what we look to do is lie flat on the floor, bend our legs so that our feet are flat on the floor, and then lift one leg off of the floor. Now the purpose of the exercise is to drive the bottom and hips up so that they end up flat in a nice straight line. Lower that bottom back down towards the floor without touching the floor and lift back up. What we're looking to do is 12 reps of this single leg variety of the single leg glute bridge. Repeat on the other side and then compare. Do you find that you fatigue quicker on one side? Does one side develop pain? This shows you that we might be having an imbalance here, or if you're unable to reach 12 reps, then overall we may have a lack of strength. The next test that I tend to use is very similar to in terms of what we're looking to investigate, but I call this the single leg power up. Here what we're looking to do is rise out of a chair using one leg only. And again, this is really looking to test the explosiveness of those glutes and hamstrings, and can we sustain that? Because when we're running, although we're looking to go forwards, it's the muscles that actually are looking to drive our legs or our hips backwards that ultimately propel us forwards. So we need to have this strength, this explosive power in those glutes and those hamstrings area, and we need to make sure that we've got the ability for them not to fatigue too quickly, because otherwise other muscles are going to have to do that role, and that's what leads to the dysfunction. So as we stand from this seated position using only one leg, again what we're looking to do is complete 12 reps of that exercise and compare right to left. Are we noticing any difference? The third exercise that I tend to use is a single leg squat. Classic exercise, the squat, one that we use because it's a compound exercise that really uses multiple muscles. So when we're in this sense and we're looking at imbalances and we're comparing right to left, it's fantastic to use a single leg squat exercise. So we simply stand on one leg and we look to go into that squatting position, taking the knee over the middle toe and return to the start position. Again, complete 12 repetitions on one side, same on the other side. How does it feel? Do you typical imbalances that we see here are where the knee starts to not be able to be kept in that straight position and it drops in over the big toe and perhaps shifts our weight inwards? That's telling us that we've got a lack of strength potentially in the glute area. Do you find that the fatigue happens in the quads and maybe one quad muscle isn't as strong? No matter what the dysfunction is, this will highlight to you if you've got an area, and therefore you can look to correct it. The fourth exercise that we're looking to work on is what we call a calf raise. So again, a crucial element of the running action is that we're able to propel forwards through our calf muscles, because that's what really looks to push us forwards. So what we simply do here is we take one foot and hook that behind the other foot so that it's off the floor. And then the foot that's remaining on the floor, we look to push ourselves up through the toes and the ball of the foot so that the heel is off the floor, and then slowly return that back down. So this is that propulsion stage of gait that we talk about. Our gait is our walking stance or running stance. So having the ability to be strong in the calves and not fatigued means that we can carry on propelling ourselves forwards through this running motion. So complete 12 reps on the right hand side, then 12 reps on the left hand side. Again, what's the difference? Are you starting to fatigue much quicker in that side, in one side than the other? Are you developing pain in one side or the other? Here, this tells us that we've got a dysfunction. And the final test that we look to do, I call the hopping test, where what we're simply looking to do is hop on the spot for 30 seconds on one side and then repeat on the other. The purpose of this test is really to try and mimic the repetition of the running, the repetition of the ground impact force that we experience. So if you're able to complete this hopping exercise for 30 seconds without bringing on pain or dysfunction, that's really telling us that that's where the level that we want to be. But if you find that you get pain or you get problems when doing this exercise, again, this is more an element that we've actually got perhaps a problem or a issue, an injury that needs to be addressed before we return to running. So there we have it. There's our 5 clinical tests that we would be taking patients through in order to really ascertain, is there a strength imbalance in those lower limbs? And particularly the first 4 tests where we're looking to perhaps drive the body to fatigue, to highlight any of the dysfunction. If you're finding that to be a problem, if you're unable to complete 12 reps, then what we can look to do is take that and use that as a strength building exercise. And again, perhaps we might reduce the amount of reps to perhaps 8 reps, but look to do 3 sets. And ultimately what we want to do is build back to being able to complete 3 sets of 12 exercises and to feel exactly the same on the left and right hand side. I hope that's been helpful. If you think these tests are going to help you, or you're looking forward to getting going, trying out these tests, hit that like button, because that will mean that others will be able to see these tests. And also it's going to let me know that these are the type of things that you want to be doing. And also, if you haven't subscribed to our channel yet, make sure you do. Hit that subscribe button, hit the bell notification, because then I'm going to keep bringing out this content to help you in order to understand your body, eliminate pain and achieve those professional goals. So make sure you hit subscribe, and here's another video that you might find to be helpful.